Welcome to my channel. Don't forget to like and subscribe. Thank you.
HIV, or human immunodeficiency virus, is transmitted when certain body fluids from a person who has HIV come into contact with a mucous membrane, damaged tissue, or are directly injected into the bloodstream of another person. The virus specifically targets the immune system, making it harder for the body to fight off infections and diseases. Here's a detailed explanation of the main ways HIV is transmitted. Number 1. Sexual contact. Unprotected sex is the most common way HIV is transmitted. This includes unprotected vaginal, anal, or oral sex with someone who has HIV. In vaginal sex, HIV can be transmitted from a man to a woman, woman to man, or woman to woman. The virus can enter the body through the delicate tissues lining the vagina or cervix. Anal sex is considered the riskiest type of sex for HIV transmission. The lining of the rectum is thin and may allow HIV to enter the body. HIV can be transmitted from an HIV-positive partner to the receptive partner or the insertive partner, though the receptive partner is at higher risk. Oral sex, while much less common, can also be a transmission route if there are cuts, sores, or bleeding gums in the mouth of the person giving oral sex, allowing the virus to enter their bloodstream. The risk of HIV transmission is higher if either partner has a sexually transmitted infection, or STI, as STIs can cause sores or inflammation, which make it easier for HIV to enter the body. Number 2. Blood transfusion and organ transplant. In the past, HIV was transmitted through blood transfusions, but today, this is extremely rare in countries where the blood supply is carefully tested for HIV. Receiving an organ or tissue from an HIV-positive donor can transmit the virus, but this risk is minimized through thorough screening of donors. Number 3. Sharing needles or syringes. HIV can be transmitted when needles or syringes are shared among drug users. When an HIV-positive person uses a needle, the virus can be present in their blood. If someone else then uses the same needle, the virus can be injected directly into their bloodstream. Sharing other drug-related equipment like cookers, cotton, or water can also transmit HIV, although the risk is lower compared to sharing needles. Now let's talk about mother-to-child transmission, also known as vertical transmission. During pregnancy, a mother who is HIV positive can pass the virus to her baby. The virus can cross the placenta and infect the baby. Additionally, HIV can be transmitted during vaginal delivery when the baby is exposed to the mother's blood and other fluids. And, HIV can also be passed from mother to child through breast milk. However, this risk can be reduced significantly if the mother is on effective antiretroviral therapy or ART and follows medical advice regarding breastfeeding. 5. Occupational exposure healthcare workers. There is a small risk of HIV transmission in healthcare settings, particularly if a healthcare worker is accidentally stuck with a needle or sharp object that has been contaminated with the blood of an HIV-positive person. This is known as a needle stick injury. 6. Blood contact through cuts or sores. Direct blood contact HIV can be transmitted if HIV-positive blood enters an open cut or sore on another person. This is why it's important to avoid contact with someone else's blood, especially if you have any cuts or abrasions. What does not transmit HIV casual contact? HIV is not transmitted through casual contact such as hugging, shaking hands, sharing utensils, or using the same toilet. Saliva, sweat, and tears. These fluids do not contain enough of the virus to cause infection. Therefore, kissing, unless there are open sores or bleeding gums, does not transmit HIV. Air and water. HIV cannot survive long outside the human body, so it cannot be transmitted through air, water, or by touching surfaces. Insects. HIV is not transmitted by insects including mosquitoes or ticks. Prevention strategies. Condoms. Using condoms correctly every time during sex significantly reduces the risk of HIV transmission. PrEP, pre-exposure prophylaxis. This is a medication taken by HIV-negative people at high risk of infection to reduce their chances of getting HIV. PEP, post-exposure prophylaxis. This is a medication taken within 72 hours after potential exposure to HIV to prevent infection. ART for HIV-positive individuals. People living with HIV who take antiretroviral therapy and maintain an undetectable viral load cannot transmit the virus to others. Undetectable equals untransmittable, or U equals U. Avoiding needle sharing. Not sharing needles, syringes, or other injecting equipment helps prevent HIV transmission. Understanding how HIV is transmitted and following preventive measures can greatly reduce the risk of contracting or spreading the virus.